The symptoms of TMD include, and no one disagrees with this comment, the symptoms of TMD, and you don't have to have all the symptoms, but most people have many of them: frequent or recurring headache, earache, jaw pain, neck pain; tinnitus, ringing in the ears; subjective hearing loss, a feeling of fullness in the ears like you've been swimming and can't clear your ear; dizziness, vertigo; upper back and shoulder pain and tightness or tightness; arm, hand, finger tingling or numbness; and various kinds of jaw locking. Those are the well-accepted symptoms of TMD, which are very disparate symptoms, and they can occur in one patient. In fact, we frequently see all of those patients in all of those symptoms in a single patient. And for our medical colleagues, my medical colleagues, and the patient comes in with various symptoms on that list, medical doctor just says, "You must be crazy." And most dentists don't want anything to do with TMD because they don't understand it, or they don't understand it and prescribe a night guard and hope the patient doesn't come back. But the point is, those are the symptoms of TMD, and how do those symptoms originate from some kind of damage to the temporomandibular joint? Well, damage to the temporomandibular joint, the common denominator to damage of any kind is inflammation. When the body in any way, shape, or form becomes damaged, the immediate response is inflammation. If the inflammation doesn't go on a routine basis to full and complete healing, it is called chronic inflammation. And that is exactly what you see in each and every patient who has TMD, temporomandibular joint disorder. They develop sooner or later chronic inflammation within the temporomandibular joint. How do I know that? I know that because after 2,000 temporomandibular joint surgical cases, each and every one of those cases, a piece of tissue was sent to the pathologist. That is standard operating procedure in any operating room. A piece of tissue is taken from the surgical site and sent to the operating room for review. And in each of those 2,000 cases, the pathologic path review returned as line 1, chronic inflammation.